responding to the adverse effects on health and preparing for what's to come that may be worse. The work in these reports are all available online on the IAP website, which I can give you details of, focused on beginning to discuss science-based solutions, both mitigation and adaptation. Of course, both are needed and are needed in an integrated way. There's a lot of discussion, of course, about mitigation options, including those that bring co-benefits for health. And you'll hear more about that this afternoon. But I want to focus more on adaptation solutions for the next couple of minutes. There really is rather less evidence available, again, particularly from low and middle income countries, to quantify health adaptation solutions to climate change. And that was the purpose of the new work that I'm describing. As I mentioned, it's a joint study inviting case studies of climate change adaptation solutions. The elements are described here and reviewed in a little bit more detail in the science policy brief that I've left there. And also we will be publishing a collected volume of the individual case studies very shortly, but by the end of the year or early next. These have been collected during the course of this year. When designing the call for case studies, we emphasised the importance of planetary health approach, the systems-based research framework, focusing on co-production of solutions with end users and on vulnerable communities. So that provided the framework for what we did or what the case studies were selected to show with regard to particular themes: food systems and agriculture, energy production use, urban environments and health system strengthening. Now you appreciate I obviously haven't got time to, you're pleased to hear, I haven't got time to go through all of the case studies that were compiled. We've selected three very brief presentations following mine or following Christine's to give you a flavour of some of these case studies. But I do just list them here, and the ones in bold are the three that you will hear about. And I won't say anything more about those. I will leave that to the presenters. And as I say, within the archive that we're now producing, we have a significant number, significant geographical distribution, different approaches, different themes, and so on. And I will briefly encapsulate what we learnt from all that, but won't take up much of your time before we actually get on to the reality of these. And these are real-world solutions. Okay, so without overgeneralizing from this group of very disparate studies, we managed to synthesize certain common emerging messages listed here. That is essential or very desirable to go for the win-win goals, that is health equity and environmental sustainability, where that is possible to do so in building the study, even if less ambitious than that, then we do need to be aware of issues for trade-offs and inadvertent consequences and so on for action on something relative to something else. Many of the studies do represent cross-sectoral integration. That is, we emphasise that health adaptation under climate change is not a matter just for the health sector itself. Health issues are obviously very relevant to many other sectors: agriculture, other land use, urban planning, and so on. And there is a need, a systems-based need to integrate across the sectors, both in terms of thinking about research and in terms of informing policy development across sectors. Health adaptation it is different from mitigation in the sense that there is a common metric for mitigation, greenhouse gas reductions, to measure success. But there isn't a common metric so far for adaptation. So we need to be conscious of the alternatives for measuring health and health adaptation, to try and standardize approaches so that we can compare studies and so on. But also, of course, to try and quantify the impacts in order to understand the limits to adaptation, because that's important, to avoid maladaptation, because that's very important, and to quantify lessons that can then be shared or upscaled more generally. So I'll leave it there. So I will pass on to Christina, who will describe some of the other work we're going to hear this afternoon, and then we essentially will go into a shared selection of the individual studies. Thank you.
Thank you, Robert, for the introduction. And now Christine, the research director at the CISRA.
Thank you very much. Very happy to be here. My presentation will be focusing on one of the climate hazards that is striking more and more Europe. If I can get my slides up, that would be great. So I will be presenting on behalf of the Exhaustion Consortium, which is a project that has been going on for a few years now. It's funded by Horizon 2020 program. We are a very interdisciplinary group of people working in the climate science, air pollution modeling, epidemiologists, economists, a lot of different disciplines working together to look into how heat stress and increasing temperatures are affecting the health of Europeans. So as part of our study, we look into scenarios, or we use the data, historical data and scenario data, to look into how temperatures and extreme heat events have been increasing in Europe. And this is just one example. We have a broad group of people looking into different aspects, but this is just to show, to give an indication of the severity of heat stress in Europe. So one heat index is the warm spell duration index. It basically says something about the extension of heat waves. I will not go into the definitions. But historically, looking into the 30-year period from 1980 to 2010, the warm spell duration index increased with 2 to 3 days per decade over these 30 years. When we use scenarios, the different scenarios, we see that this is projected to increase by somewhere between 3 to 8 days per decade in the future scenarios towards 2050. And so basically we find that increases in extreme heat days and magnitudes are larger than for average temperature levels. So we are moving into a future where not only the global temperature is increasing, but we will have increasing heat spells, stronger and more long-lasting heat spells, heat waves in the region. An important part of the Exhaustion project is to investigate what is the relationship between temperature and mortality in European populations. So this is an example where we use city data from hundreds of European data, or the cities, or we estimate for, I think it's 800 cities, based on data from somewhere around 200 cities. And I'm not going into the details, but the point with showing this figure to the left here is to show these U-curved functions between temperature and mortality. I mean, there's an optimal point where we cannot observe any increased mortality, but when it gets hotter, more people die, and when it gets colder, more people die. And you can see from this figure that these functions look very different across European cities. So we are also interested in understanding why are these functions, or why is the relationship differing across cities. So in the middle figure, you can see that heat-related excess death rates is differs a lot across Europe. It's higher in the south than in the east. And we have also used different types of data to investigate what might be some factors that makes the vulnerability or the sensitivity to heat differ across these cities. And you see some factors that we have been able to look into. Individual factors, high age, obviously older people are more sensitive to heat than younger. Women seem to be more sensitive, vulnerable. High blood pressure is one of the factors we see that turns out to increase or to make these curves steeper on the hot side. Cardiovascular disease, and also we know from before that pregnancy, infants and low mobility are factors that can individually or increase individuals' sensitivity. There are also some area level factors. We have looked into social factors like low education, high unemployment rates, which also seem to be making an area, or the population in an area, having higher mortality rates related to heat. Not the least, area level ambient factors, which is an important part of the Exhaustion project to see how high air pollution levels increases the vulnerability. And that is one of the clearest findings in our study. We also see that high population density and urbanized areas have a higher sensitivity. And also, little green space is important, which could be related to urban heat islands, for instance. So this is just outputs from kind of a statistical analysis showing the relationships. This figure is an illustration of the modification of air pollution on heat stress. So I made a red round where you can see the overall estimate for all the European cities, the meta-analysis. And basically we see the lower column shows that if you go from moderate to very high temperatures, mortality rates increases with 10%. The darker, highest column shows the increase in mortality if you have simultaneously high air pollution. So the first one is for low air pollution and then for high air pollution. So basically, mortality related to heat stress is doubled if you have high air pollution compared to a low air pollution situation. And this actually leads us to say that reducing air pollution is an adaptation measure for heat stress. If we have heat stress or hot temperatures, having lower air pollution will mitigate some of the problem. Of course not all, but it will reduce the mortality impacts. This is just another figure illustrating the point with green space. We have looked at...
Chris, you have just 1 minute.
1 minute, okay. So we see that in European cities, many cities are losing green space. And this is just a correlation showing that if you lose green space in a city, it also gets hotter. So this is, you can always discuss methodology. This is just a relationship. And I think it shows quite clearly that if we preserve green space in areas and make it a larger part of the area or of the urban design, so to speak, it will limit urban heat islands, which would be important for health. These are projections for heat stress in Europe. This is for 3 scenarios: low emission scenarios on the left-hand side and the high SSP3 scenario on the right-hand side. The point here is simply to see that there is a total increase in number of deaths due to global warming, whatever scenario we look at. It's not like someone might think that, oh yeah, if global warming comes with fewer cold deaths, because cold deaths is also important. But the net effect is clear, it's positive effect. It means more people will be dying in the future because number of deaths related to heat stress will grow larger than the reduction in cold deaths. So these are just to illustrate the point with knowing about the vulnerability factors, which is one part is the demographics, showing that the large gray point, then we assume no global warming. And still the number of cold and heat related deaths will increase because we have an aging population with a larger pool of susceptible individuals. I don't think I have time to go into the details, but it basically shows my point that today, 16% of temperature-related deaths in Europe is due to heat. The rest is due to cold, but this is switched. In 2100, 55% temperature-related deaths due to heat. So this is will be increasing. I have to end with one figure showing that this is about, our study is about Europe, but we know that, which is not that hot, it's not that polluted. What about countries in the global south where they have much higher temperatures and they're also reliant on solid household fuels, so their exposure to air pollution is much higher than in the European population. So this is just as a knowledge gap. We need to consider our studies in this part of the world. Conclusions is basically what I've said. Climate change leads to rapidly increasing extreme temperatures overall, and cities even more so. Health effects of heat stress are amplified by air pollution, and every year we delay action to mitigate global warming comes with a rapidly growing health burden. Knowledge on individual and contextual vulnerability factors can help designing effective adaptation policies. We need to know why some people are more susceptible than others. Thank you.
Thank you to both speakers for really excellent introductions. We're going to go to an online presentation. And while we do that, if I could get the other two speakers to come up, we're going to talk about the case studies so that we can be a little more efficient up here. That would be great. And I'm very pleased to introduce Yoting. Are you online, Yoting? You were online. I can see you way down at the end of the room, but we don't see you on the slides yet, or on the screen yet.
Can you hear me as well?
Yes, now we can hear you. It's great to hear you. Sorry that you're not here, but really delighted that you can be online. It's Yoting Hong Lockman.
Yeah, also nice to see you here. Okay, let me know when the slide is up.
Close. We see the exhaustion.eu slide. Do we have Yoting slides? Yoting's at Garrix and is doing quite a bit of work right now on a project about energy, climate change, and aging. We have slides, but they're not yours. Sorry, Yoting, there always has to be technical issues.
No problem. If you can bear with us a bit.
We're ready now. Take it away.
Perfect. So I can't see the screen what you are showing on live, but I'm sure that you can see my slide. So my name is Yoting Hong Lockman. I'm a researcher from Climate Service Center Germany, Garrix. Oh, now I can see everything, thanks. And together with my colleague Karen Casaros, we are sharing a talk that we would like to talk about what we are doing in our research group. We are a research group called Co-Care Society. We would like to integrate these three topics together, and we are working together to bring the knowledge of climate change, energy, and health and long-term care together. And please prompt to the next slide. I would like to start with the figure of IPCC, and then I would like to show you that why is it so important to link climate change and health and long-term care together. So we can see from this generational cohort experience that from the previous generations, for example, the born in the 1950s, until today, they actually already experienced climate extremes that they never experienced before when they were young. But when you look at the future generations or the generation that's born after 2000, you will see that when they get old, they will experience more extremes throughout their whole time lifespan. And this is what we would like to put the emphasis on, how important it is. We look at what the future aging society will look like when it comes to climate change and health, and when we are right now already investing in the topic of the long-term care. And please prompt to the next slide. You might need to, jump to the next part. And what we are doing in the co-care society, that, can you go to the next slide, please? Yeah, here, perfect. So what we are doing in the co-care society is that we are looking into the knowledge in practice as well as in research. So we found currently there are quite strong disciplinary knowledge in health or energy or climate change, but not putting the three knowledge together to look at them together. And also we found that in the policy, so for example, the energy ministry or health ministry in your countries, when they are putting the investment forward, they are looking these three topics separately and also not to integrate the policy together. So our work is to look at the knowledge of these three and try to bring these three together. And that's what we are doing. And we are focusing on the case study not only in Germany, but also in the Asian countries, as well as in the least developed countries in Africa. And this is the focus of our work. And now I would like to give the floor to my colleague, Karen Kassel, to show the latest findings we have in our group.
Thank you, Riting. Can we get the next slide, please? Thank you. So we wanted to show you this today. It's from a paper that's under review, but this is the result of our first study that we did, in which we administered 2 different workshops with climate, health, and energy experts, both from the global north and the global south. And we asked them to predict their future demands, either with health, energy, or climate change, using both their personal experience and professional expertise. And what we did after the workshop was we compiled all the answers and we made this figure. And you'll see it's quite an intricate web of interconnections. And the reason that we wanted to show you this today is because we wanted to kind of give a visual that if you make changes in one sector, it's not possible to not have changes in other sectors, because they're all interconnected. And just one example, I think we had this example quite a few times, was that people said that as climate change becomes more severe, we'll experience hotter weather, and then we'll need more energy to cool houses, and those who cannot afford that will become more sick. So I want to leave you with this visual, and then we'll move on to the next slide, please. Thank you. And this is the end of our presentation, but we want to leave you with 3 key messages and policy recommendations. So the first one is that we need an integration of policies. As we saw in the last slide, changes in one sector will have impacts on the other. So we need a systematic collaboration to ensure that all outcomes in all sectors are addressed. Next, we recommend that climate services should be utilized, especially ones that are co-created with end users and adapted to their needs. So, for example, older populations will have different needs as far as climate services than somebody who is not in that demographic. And we also need to act now so that we minimize the adverse impacts for later. And lastly, with the integration of policies in multiple sectors, we can uphold existing agendas such as the SDGs, the Paris Agreement, and the other policies that you see on the screen. Next. So we'd like to thank the German Federal Ministry of Education and Research for support of the Co-Care Society project. Next slide, please. If you'd like to keep up with us, or if you have any questions, please just take a picture or remember the email address at the bottom of the slide here, and we'd be happy to collaborate or work with you. So Routine, unless you have anything else to say, we can hand back over to Chris.
Thank you.
Thank you for your time.
Thank you. That was really an excellent presentation. We appreciate you keeping to time. I do have one comment. I know that a number of people took photographs of a piece of work that's under review. Please do not share. Thank you very much. And we're moving on to Victoria Pratt, who's going to talk about another case study. Victoria?
Great. Hi everyone, my name is Victoria Pratt and I am part of the Land Body Ecologies Research Group. We're a transdisciplinary research group. We're based at the Wellcome Collection in London and we're also based in 5 international research hubs around the world. As it says here, we're a big group of different types of people. So I myself am an artist, but we also are led by researchers, designers, technologists, indigenous leaders to do our work. The case study that I'm here to present today is our work in Thailand. I'm presenting on behalf of Siwakorn Odacho from the Pakenyao community in northern Thailand. So our research in Bang Non Thao looks at the impacts of climate change, particularly unpredictable weather systems, and how that's affecting the indigenous food systems of the Pakenyao. How they have adapted to this over time is to develop rice banks that means that the community come together to share rice, and this method has worked pretty well in the past, but as rainfall becomes increasingly unpredictable, this has been harder to maintain. And I want to talk about both climate change impacts on these food systems today, but also the conservation policies in response to climate change impacts that is further putting stress on the nutritional, cultural, and mental health of the Pakenyao community. This is going to be hard to tell in 5 minutes, but I'll give it my best. So, Bang Non Thao, the Pakenyao Karen community, traditionally practice a thing called rotational farming. And at its base level, rotational farming takes place across 7 plots of land over 7 years. So what the community does is they farm 1 plot. After a year, they leave that plot, move to the second plot, etc., so that the first plot is only returned to 7 years later. And the reason for this is to let the forest and the soil regrow, and so that that land becomes fruitful once again for farming. This is a practice that they have developed, maintained over hundreds of years, and current conservation policies, which I'll go into in detail in a second, are putting stresses on the community's ability to practice this rotational farming technique. Importantly, Pakenyao farming takes place on both lowland and mountainous upland plots. So the current conservation policies, probably set somewhere like COP, are global conservation policies linked to carbon offsetting targets, etc. We know all about these. And the way that those are kind of analysed within northern Thailand currently is through an area-based approach to land, which is using a lot of satellite data to look at where farmlands are and where forests are, and from that data determine which areas could be protected forest. Going back to the point that that the community practice on mountains and in forests, 2 of the current policies within the Thai Forestry Department are that farms can't be on mountains and forests can't be farms, which completely negates all of the traditional practices of the Pakenyao community, as they practice on farms, they farm on mountains, and they let their farms regrow over 7 years so they look like forests. So what this has done has led to the community resorting to over-farming their forests, so breaking the 7-year rotational farming system, over-farming the land so that they don't lose the land through this new conservation policy, which says that that land should be forest. Breaking the rotation system importantly has impacts on the soil health, the food systems and food security, as well as the health of that community and the ability to practice their traditional farming techniques that has supported their lifestyle over many years. One example of this, just to zoom in a bit, this on the left, you have Sway's dad's garden. He's called Johnny Adacho. He has created that garden over 50 years. It has everything you could need to eat, to live. It has resources to build. They describe it as a supermarket for the community. That has just been classified as a forest, and the community are no longer able to access that land. That's just one small example. The picture on the right is Sway's son listening to a recording of his umbilical cord tree. Within the community, when each baby is born, the umbilical cord of the child is put in a bamboo box and tied to a sacred tree that's found by the father. That tree and that child are then intimately linked for life, even to the point where the community member then passes on. The tree is cared for by the community after a life as a link to that ancestor. Again, this tree exists within this garden that has currently been rezoned and reclassified. So a lot of our work is looking at the different types of effects that, like I say, climate change has on the community, but also this double burden that occurs through conservation policies set very far away from those communities, and the kind of zoomed out aerial data that doesn't quite take into consideration the ground truth or the very specific intimate connections to land that those communities have. So I just wanted to read out one quotation from our study. The big issues happened when land must be certified. It means living there without a certificate is a crime. It made the community worry and fear. Another issue is evictions force the community to focus on cultivation and growing food to sell. In the end, they take losses and go into debt. Debt piles up and they lose the land, and it causes problems for the spirit. It's bad for health, it causes alcoholism, it causes drug addiction, it causes loss of land, causes competition for natural resources. People take water, take land, take more things. We protest, but the people who create these policies don't understand. They work in offices and they live their lives very differently. In the end, people lose confidence, they lose their independence. So really, I'm just going to end on, like I say, just drawing attention through our study to this double burden of Indigenous communities and the impacts that these kind of policies, alongside climate change, are having on both their physical and mental health, as well as their nutritional health. And finally, these are our calls to action. I won't go through them all here, but I thank you for your time, and please look up the Pākehā community and how they live and what they do. Thank you.
Thank you, Victoria, for sharing this interesting case study. And now we go for our next case study presented by Claudia Canals, and she's going to join us virtually. Hope she's online. Is it Claudia?
Claudia.
Sorry, I am. Hello. Can you hear me? Can you hear me? Hello, can you hear me? It is on. Hello, can you hear me? Hello, can you hear me? Sorry, I don't know what I can do. Sorry, can you hear me? Can I?
Can hear us. They're talking,
No.
they're trying to solve this, and we're going to try and go to the video and come back, because she's got 2 open mics, and we don't have any mics at all.
No, now it's working.
Now it's working?
Yes.
So why don't we go to the video while you solve the open mic problem? If you can? That would give you some time to talk in the background.
So you're going to show them, yeah.
Yes.
Perfect. And the video is from, it says, it's from Ghana. Is there a name of the person?
My name is Ben Howard, and I'm a researcher at Imperial
great.
College in London. I'm from the United Kingdom.
My name is Cynthia Awuni. I come from Ghana. I'm a PhD candidate with the University of Ghana and also a scholar on the Pathways to Equitable Healthy Cities project.
So we're currently working in a city in northern Ghana called Tamale, and we're using a co-production methodology to try and enable equitable flood adaptation. So what that means is we're using a research process that brings societal partners like local governments and communities to the centre of the research process. We're trying to understand flood risk in Tamale. What are the drivers and components of flood risk, including the sort of magnitude of hazards, how different people are exposed to flooding, and the vulnerabilities that make people be impacted by flooding.
The case study we presented tried to look at what are the challenges that people in Tamale are bedeviled with flooding. And so what are the issues related to accessibility, their location, is it urbanization, is it about densely populated areas, is it about the location that they stay, or is it that they don't have income to be able to support themselves when there's issues of flooding? So then what are the inequitable elements within Tamale that drives flooding?
We're especially interested in adaptation to flooding, and that means finding ways to cope with increasing flood risks. So we're interested in how different levels of adaptation interact to determine an overall flood risk for an individual and for a household. So city-level adaptation is things like storm drain networks, and we're trying to understand how the current storm drain network changes flood risk within the city, and how it has been designed or not designed affects the way that outcomes are distributed. We're also looking at community-level adaptation, and this includes things like behavioural changes, sort of evacuation plans and early warning, and also structural changes like embankments and community-level drainage. And then finally, household-level adaptation is things like building houses of higher quality that can withstand the flood, and building houses on platforms or in compounds.
And so we are trying to look at the case study and see how we could bring about access to equitable adaptation strategies for people living with Tamale to be able to avert flooding. So basically our case study talks about the process of how we bring stakeholders together related to academia, related to local city authorities, local authorities, communities, to discuss issues around flood and health, and how the urbanization within that system has created problems related to flooding, and how it affects their health status, their incomes, and many more.
So we're starting to reveal that different groups of people have different levels of access to these adaptation opportunities. So people that are wealthier, of a higher socioeconomic status, they tend to have higher access to these levels of adaptation. And sometimes that also means that some of the exposure, some of the risk is offset from wealthy communities into poor communities. So on a city level, this actually reduces climate resilience. So we're trying to find ways that we can enable a more equitable adaptation approach on a city level. And that means designing a city level strategy, including these societal partners. My name is Ben Howard, and I'm a researcher at Imperial College in London. I'm from the United Kingdom.
My name is Cynthia Awuni. I come from Ghana. I'm a PhD candidate with the University of Ghana, and also a scholar on the Pathways to Equitable Healthy Cities project.
So we're currently working in a city in North.
Thank you. So I hope Claudia is now okay and can start her online presentation.
I don't know if...
Yes, we can hear you.
If you can hear me.
Yes.
Can hear you. Oh, okay. Thank you. So apologies for earlier. And thank you for the opportunity to present. So I cannot see my slides, but I think you can. So if you could move to the next one, please. Thank you. So the focus of the work we do at the Kirkus Trust is food and nutrition, focuses on food systems, food and nutrition security. And as you can see from this slide, this remains a very big priority. The number of people who have food insecurity continue to increase, and about 3 billion people cannot afford a healthy diet. And of course, a healthy diet is key for a healthy lifestyle. To the next slide, please. So climate and climate change has a very big impact on food production, especially in areas that rely on precipitation for water, because having too little water or too much of it destroys the whole harvest. And of course, with climate change, this is happening more frequently. And to the next slide, please. At the same time, climate change is contributed, so food systems contribute about a third of the anthropogenic greenhouse gas emissions. To the next slide, please. So the question we wanted to ask is, as a small organization with limited funds, how can we increase the impact of these investments, considering also all the sectors are interrelated? Next slide, please. So the Kirkus Trust is a charity registered in the UK. We focus on legumes because they are very nutritious and they can be grown in very arid areas. They usually receive much less funding than the key commodity crops that are traded internationally. And the way the approach is to fund or to support crop improvement programs, so making varieties of these legumes that are more resistant to diseases and stresses like drought and heat. We do so by establishing in-country or promoting in-country scientific capacity, and this is through training, but also establishing laboratories and greenhouses, and then nurturing scientific communities, so a group of people that share common problems. So therefore, to encourage sharing also of solutions and knowledge. And because we're small, we actively encourage and follow partnerships to address other actors in the food system, but also in other systems. To the next slide, please. So these are the projects we currently fund, mostly in Africa, a few in England. The projects are divided in consortia. So we have one that focuses on common bean, one on cowpea, and one on a group of legumes that are particularly resistant to heat and drought conditions, but they've been traditionally neglected by funding organizations. And next one, please. And next slide, please. So this just would like to acknowledge the people who actually do the work. And so the key elements of this funding model is scientific mentorship. We have a number of consultants who work with the researchers, work very closely with them. We have awarded master's and PhD scholarships and continue to do so. There is training during the meetings and also visit studies to laboratories in the US and Europe. Next slide, please. Sorry. And as I said, it's key that the people who receive a grant are able to do the work in their own country. So and this slide shows Anne, my colleague, who's preparing a consignment of laboratory equipment and reagents to be sent to Ghana. And then we also have the team in Zambia in front of the screen house provided. Next slide, please. It's very important to engage actively the intended beneficiaries of the project, so smallholder farmers, and they're very important because they direct the direction, well, they direct the research, what they want in terms of the varieties that need to be improved and what the key constraints are. Then they're also the ones who participate in evaluating the varieties at the end of the process to make sure they meet the demands. Next slide, please. And we intend for the support to be long-term. A crop improvement project takes a minimum of 6 years. So this slide shows two people, Esther and Sobda, who were supported by the trust by KT since they were master students. And now the pictures below show they have their own successful research groups in Kenya and in Cameroon, respectively. Next slide, please. So lessons learned. I think because KT has relatively modest amounts of funds, we operate as a trust in perpetuity. So as long as we keep to the budget, we can go on indefinitely if we are careful. But for us, we established that a narrow intervention focus was important for impact. And it was critical to establish scientific communities that then are able to amplify the gains in one country and another. Many of the countries share common problems. Long-term support, as I said, is important. And just to finish my presentation, we know that it's important to have a cross-sectoral intervention. So for us, the way to address it was with partnerships. But the key is that you need enabling integrated national and regional policies for small-scale actors to contribute to national development plans. And this is both in the not-for-profit and also for private sector partners. And I'd like to thank you for your attention.
Do you want to introduce Caroline? Yes. Oh. Well, thank you. That was great. And I really appreciate the ability to get over those technical problems. It was quite interesting. And the last person in the session is Caroline. We're glad that you're up here, and we look forward to hearing about your case study from Kenya. Can I do it from here? Why not? And then you can do your own slides.
Thank you for the opportunity to be here today. As you've heard, I'm Caroline. I work at the Aga Khan University in Nairobi, Kenya. And I was tasked to talk about some of the impacts that women in Kenya are facing due to climate change. And so what I did was to look at existing evidence and what are some of the major impacts that are presented in this evidence on how women are being affected. And so what I'll focus on today is women in rural areas in Kenya, where we have frequent extreme weather events, and what are some of the challenges that they face. And so I'll start by laying out these challenges and then talk about some of the existing solutions and other solutions that are still not yet there but should be prioritized. So it's a conversation. I like that Christy said it's very informal. And so how are women being affected? And the first one was food-related issues. Yeah, women in Kenya are primarily the people who are tasked on looking for food. And I also found a very interesting fact that women are more prone to nutritional deficiencies during climate-induced food shortages, which is mind-blowing. And additionally, women tend to prioritize other people in the household when there is food shortage. I'm yet to meet a woman from my community who eats first when there's no food. It's always the children, then the husband, and then what is remaining is what they eat. And this exposes them to food-related issues such as undernutrition and malnutrition. And then the next issue is related to water. Women in these communities have to go far to look for water during these dry seasons. These are things that we've had over and over again, but then it also brings up other issues, such as when you have to walk far under the heat to look for water, the other physical issues that come up, such as back problems, heat stress, and something else, insecurity-related risks to these women. And then climate-sensitive diseases. We keep hearing that malaria is increasing. We keep hearing that other vector-borne diseases are coming up. And we know that pregnant women are the people who are at a higher risk of serious infection due to some of these diseases. And again, the burden of waterborne diseases for some of these women, such as cholera, is a double burden when you put together issues of food, undernutrition, and the double burden of waterborne diseases. And then we have household air pollution. Women in rural communities in Kenya still use solid fuels, exposing them to some of these pollutants that increase their risk to respiratory and cardiovascular diseases. Maternal health, we have studies like the Chamna study that highlighted some of the impacts of some of the heat-related impacts on maternal health, and it showed that it brings about negative birth outcomes, things like stillborn, underweight, and also some other negative birth events. And mental health, these things compounded together lead to negative mental health issues in women. And then ongoing research continues to link climate events and sexual reproductive health impacts such as gender-based violence and intimate partner violence. And there's also the reduced access to health services during extreme weather conditions. We are currently experiencing flood in Kenya, and we're seeing that these events are compounded. Yeah, and other social impacts such as missing school, increased school dropouts by girls, and affected livelihoods by women. And these are important social determinants of health. And lastly, that came up recently that was quite mind-blowing to me was snake bites. Apparently, when it's hot, snakes tend to move to households. And this increases the exposure to snake bites within that household. I found that to be quite interesting. And what are some of the solutions for Kenya? And number one is to continue to insist that these communities, each community has their own issue. Yeah, when we're going to implement some of these interventions, let us engage the women in identifying some of the priority solutions and also involve them in developing some of these solutions, this will have a more sustaining impact. And then research, as I've said, there's research that's ongoing in the country that mostly focuses on women. Again, I'll give the example of the Chamna study, and of course to continue to encourage researchers to give us gender disintegrated data in research. And also when the Ministry of Health, when they go out to do their surveillance, to make sure that they look at the different impacts to the different genders on some of these extreme weather events, and of course to continue to encourage that vulnerability and adaptation assessments are done so that we can identify the different areas where more people, the people who are vulnerable, and also identify where and what to do and inform the adaptation plans. And then for policy, we have 2 key policies that highlight the impacts on health, on women, and some of the intervention strategies that can be undertaken. And the first one is the Kenya Climate Change and Health Strategy that is being launched very soon, and the National Climate Change Action Plan, which highlights what these women are going through, and it's being led by the Ministry of Environment. However, it's good to see action on policy that is specific to these vulnerable groups. And lastly, on air pollution, the Ministry of Health is spearheading some projects that seek to address how household air pollution is impacting women in these rural communities. And for example, we have the Clean Air Project that increases advocacy and encourages behavior change among women so that they can adopt better and cleaner energy sources for use in their households. And this one is not yet being done. However, it's something that we feel is a priority to increase the health system's resilience in Kenya. Again, as I said, women are still not able to access healthcare in the face of some of these extreme events, and this is something that we've seen in the recent floods in Kenya. And lastly, we need to do a lot of advocacy efforts, do knowledge dissemination, and campaigns that amplify the stories of how women are affected by these extreme weather events. And I'll focus on 2 strategies that are working on this. And the first one is the Chance Network, where we are a group of climate and health stakeholders in Africa, and we encourage exchanging best practices, and women's health is one of our priority areas, and so we bring in researchers who are working on this to disseminate their information to other members. And lastly, I wanted to highlight a campaign that I came across very recently called the Niko Active campaign, which basically means I am active. And I'm glad to see one of the people who is leading this campaign here with us. And what they're doing is that they're going to communities and telling stories of how women are being affected by climate change and health. And I think that is very important, because then some of these impacts stop becoming numbers and figures we see in presentations. We put faces to some of these stories of how these women are affected. You can search that hashtag to see some of the videos that they've come up with. I think it's a brilliant campaign, and it will have a tremendous impact. And lastly, I want to finish by saying that we are in COP28. Such headlines should really not be part of what we are seeing. Yeah, where a woman had to swim across a river full of crocodiles due to flooding to give birth to access a hospital. We are way past that. Yeah, and the other by the Red Cross, who are at the forefront of addressing some of these impacts in Kenya as we are currently experiencing flooding. So we need to do better, but we've made progress, but we still have a very long way to go. Thank you.
Thank you. That was really fascinating. I really appreciate it. We had a series of just excellent case studies. We're now supposed to have a Q&A, but we're out of time. Sorry. So I suggest you find people who made these excellent presentations, look at the book or the summary that's available, and I'm sure there's ways to contact the people, but we also have a panel discussion, so unfortunately we have to move on. Thank you. Thank you so much. Thank you. And can we get the panelists to come up here, please? And the plan for the panel is that there's several people on the panel who already spoke, and we're not going to ask them to speak again, but we're going to give the new panel members, who are all going to introduce themselves, 2 minutes to talk about whatever you would like to talk about in the context of heat, air pollution, climate change, and health.
Just 2 minutes.
What's that?
Please, just 2 minutes.
Please, just 2 minutes. We're kind of running it. And then if we have any time left, we're going to ask a few questions. So would you like to start, please?
Yes, I could start. Hi, my name is Shilpa Rao. I work at the Norwegian Institute of Public Health. I've been associated with the Exhaustion Project that Kristen presented earlier. And I was asked in this panel to actually present something from the public health perspective. So I will do that. And I wrote down some notes, so I stick to the 2 minutes. So basically, in my opinion, I think health needs to direct all climate actions at the moment. This is imperative. And this is, I think of 3 things where I think health is important. One is reducing exposures. And we already see that there has been immense amounts of research on the link between air pollution, climate change, and health. And there have also been, some policies to try to reduce exposures. For example, the WHO new directives, which are talking about reducing air pollution levels even further to deal with increased mortalities that have been detected due to that. So I think reducing exposures is important. Reducing greenhouse gases is priority, I think. So we need to start with that. The second thing I think where health plays a role is in increased surveillance and response. So there are more and more early warning systems being developed in Europe, but in many parts of the world as well. We see an increase in these early warning systems that try to integrate climate data with health data. And I think that's a very big step forward. But we have found in a recent study that we did that these health warning systems are not necessarily that effective. They're often developed, but they're not evaluated enough. And so there's an urgent need to kind of evaluate these health warning systems to see, do they actually deliver what they're supposed to deliver? Do they actually target the vulnerable communities? And I think response is another aspect of the early warning systems. The public health systems resilience was mentioned in earlier talks, and I think that's imperative coming from a public health institute. Public health systems need to be made more resilient to climate change. I think we say that again and again, but it's really important that we pay a lot of attention to increase this kind of resilience. And I think the third step where health could play an important role is in reducing vulnerabilities. There were already, I think we've seen in some presentations on how climate affects health and which kind of vulnerabilities could be important. And I think we need to target those vulnerabilities. These could be environmental vulnerabilities, for example, improving ambient conditions, reducing household air pollution, for example, was brought up. But it could also be, other kinds of vulnerabilities which these days are classified as developmental vulnerabilities. So increasing universal health coverage, increasing water, looking at water shortages, looking at wash priorities. So all of these would, in the end, benefit health, benefit responses of climate to health as well. Thank you.
Certainly can't argue with that.
Thank you. My name is Orana Andersen. I'm chair of Environment and Health Committee with European Respiratory Society, presenting respiratory clinicians and patients. I'll reflect on some of my experiences in working and advocating for clean air in Europe, which we've done a lot of work with. So how to bring health into climate air pollution policy, I think it's really important we bring evidence to the policymaker. We need to inform, we need to bring research, the newest research results, because there's still a lot of lack of knowledge in climate policies, air pollution policies, and health impacts. I like to bring a point, we know a lot about impacts of air pollution, they are huge. Air pollution is one of the main risk factors for health, but this is really not the common knowledge among climate change, among air pollution policymakers. They see this as some kind of environmental policies that are somehow disconnected from our health. And the big gap here is that health ministries and health policymakers don't know enough about climate and health. And I think today what was said in the ministerial on health by Tedros, that phasing out fossil fuel is really a public health initiative, a policy we need to really educate and bring air pollution and climate change as health policies, and maybe bring them into health ministries. So we have health ministries, environmental ministries, climate change ministries working on these disconnected policies, and that's one of the barriers that we're more successful. In bringing knowledge to policymakers, we need more research, we need to bring that research. We also need in that chain to bring more knowledge to patients, to healthcare workers, to public, and I think some of the stories, we have met policymakers that say, yeah, we know about all these wood burning effects on health, but we're not going to go for that if people are against it, if I'm not going to get voted on it. So we need to also educate people on why this is important, how this affects their own health, their own families, their environment, their cities, communities. So we have a lot of really information to public, to physicians, and to get to policymakers, as well as directly informing policymakers. I think I'll end with that. Try to keep it 2 minutes.
Vincent?
Oh, thank you. Thank you so much. My name is Vincent, and I'm from Botswana, from the University of Botswana in particular, and I'm also part of the, or should I say the University of Botswana is part of the NBEL consortium, which Cicero Christian is leading. We have work in Africa, which we have a consortium of about a few institutions, and also our responsibility was to come up with the mechanism that can bring together stakeholders working on climate change and health. And this is the work that we've been doing. We came up with the Chance Network that Caroline presented, which we're working on. And this is a network that actually brings synergies between stakeholders who are working on climate change and health in the African region. And we have a lot of activities that we do, such as webinars, bi-monthly webinars. We do have yearly conferences that we have. This year we had our second one in Botswana, where we are able to group up policymakers, gather scientists, NGOs, and other stakeholders who are interested in climate change and health. And this opportunity, like my colleagues have been saying, where we have a platform whereby we facilitate policy development, because we need that knowledge hub where people exchange. And also sometimes it's difficult when you look at the climate science language and the public health language, which is a bit more difficult for both parties. So we are trying to bring them together in one roof, discuss issues that affect all of us, share the data, and also help to drive policy. Basically, that's that. Yeah, thank you.
Thank you, Vincent. And we have online with us?
We've got Montira.
Montira. Please.
Montira Pongsiri, I'm a senior advisor and team lead on climate and health at Save the Children. So I just wanted to, in the interest of time, I'll keep my remarks very short. But as you've heard, climate is health. And some have noted that health is the face of climate change. Health is personal. People can personally understand how they are being affected by climate change in real time and what it portends for their future. The speakers noted the equity aspects of the health impacts of climate change. For Save the Children, climate and health is a climate, health, and equity challenge. So let me end with a few policy recommendations. Many countries I've worked with are interested in, for decisions they need to make now, the explicit identification of multiple benefits and trade-offs for human health, environment, and sustainable development of decisions affecting climate change consistent with the SDGs. For the SDGs and other global processes, the explicit consideration of multiple benefits and trade-offs for health and climate of health and non-health sector policies should be the objective for producing and applying integrated tools to support the cross-sector engagement and policy coordination needed to protect climate and health together. One other point I'd like to make on social determinants is that we know that the magnitude of climate-sensitive health impacts depends on the climate actions taken now. There is urgency. Climate change interacts with social stressors to affect health, and some of these social stressors are modifiable, such as socioeconomic status, access to health services, and housing conditions. So accelerating and amplifying efforts to address social determinants of health can reduce climate impacts on health. Another point I'd like to make is that health is not an externality. Climate change poses risks to health and well-being, on illness, on death, associated healthcare costs, foregone productivity, and lost GDP. So what we need to do is quantify more completely the costs and benefits of policy actions as well as the costs of inaction. This quantification in terms of exposure to air quality, associated respiratory diseases, lifestyle and physical activity changes which contribute to non-communicable diseases can help decision makers select among available climate interventions to help reduce attendant health risks. This can help make that investment case to improve health and reduce environmental risk. The last point I'd like to make is that we need to include more social scientists as part of our multidisciplinary team approach to doing science, applied science for impact. And that includes social behavioral research. Understanding the factors which drive social and behavioral change can support effective climate actions at multiple levels, individual, community, health systems. So there's great potential to apply this understanding to protect climate and health. We know that unless we dramatically change the way that we currently use our natural resources and natural systems on which we depend, we risk the health of human civilizations. These changes needed can be supported by insights from social behavioral change research. Thank you. Back to Chris and Sami.
Thank you very much, Montira. That was great. Yo Ting's also online, but you also had a chance to speak, so we're not going to give you another 2 minutes. I'd like to start the discussion. I've sat on probably way too many panels in my life by asking all the panelists if anybody has a question of each other, because I often walk out from being on a panel thinking, I wish I had had the chance. Is there someone who'd like to ask a question of any of the other panelists? Nope. Then I'll start with a question, and it's open for everybody to think about. And I'd like to tie the presentations we just heard to the Health Ministerial Conference this morning. For those of you who were not there, there was an announcement that a consortium of multilateral development banks, the Green Climate Fund, Rockefeller Foundation, and others are going to put together $1 billion for climate change and health. And I thought it'd be interesting to hear from whoever would like to talk about it, what they would like to see that spent on. You all have been working on projects with pretty constrained budgets, opportunities for scaling up, for scaling out, and open it for discussion on the panelists.
I would say a lot of the money should be spent on what was my number 2, which is increasing surveillance and increasing responses to the challenges that the health systems face. I think increasing public health resilience should be the main area where this money should be sent. This, of course, includes educating doctors, which is often talked about, so they are more, they have more awareness of environmental challenges. But I think in general, what was brought up in a lot of today's presentations is that the health systems themselves, improving universal health coverage, having very good hospitals providing health coverage to all sorts of indigenous and vulnerable communities is very, very important. So I think that's where the money should be spent.
It's hard to argue with that.
Yes, so I'll give you an example from discussions in Europe now. I would give money to low-income countries to do necessary transitions to whether there's energy system and transportations. For example, in Europe right now we're discussing Air Quality Directive, the major piece of legislation, air pollution, which is really climate and health policy. And the excuse is that poor countries that have the highest air pollution concentrations, highest number of people dying, getting sick from cancer, COPD, heart diseases in Europe, they use excuse they cannot afford transitions and they need more money to reach the goals, which will allow more years that more people die from these effects in countries that are already most people dying, and to us that's unacceptable. And that's being discussed now is a real weakening of this law. I think we need exact opposite, to give this money financial support to transition as soon as possible, to get rid of coal burning power plants in Poland and Eastern Europe that are clearly the source to help those citizens to get off burning coal and wood for burning and cooking in Eastern Europe. We know what to do. These countries need money because they're using it as an excuse now not to act. this is, I'm sure, even similar in other areas of the world where money is used as excuse. So that's where I would start spending money, because we know these would bring immediate health benefits and climate change emission reductions.
Yeah, I think I'll reiterate from what my colleague has said. I think it is very important to note that the SDG 13 on climate action has a very straightforward, should I say, target of strengthening resilience as well as adaptive capacity to natural disasters. I think health is not an exception. We have seen what happened with COVID-19. That was a natural, should I say, public health disaster that need to be prepared for. So I think most of this money should be strengthening capacity and also resilience of health systems, especially, like my colleague said, in developing countries where there's still problems. I think climate change is going to cause a lot of more of such disasters in the future, and it calls for preparedness. So we need to invest more on, developing strong policies for those developing countries so that they're able to cope and manage public health disasters that are a result of climate change. I think that money should be towards that in everything, like research, capacity building. Thank you.
Thank you. And Yo-Ting, we can't see if you've got your hands up online. Yo-Ting, Montira? We've got glare up here. I couldn't see the screen.
If you can hear me?
We can hear you. Yes, go ahead.
Perfect. So I think the budget should also go into the people who is really working at a fundamental level for the health and long-term care. So in Germany, as well as other countries right now, they're talking about a reform of the health systems. And one of the reasons for the reform is that they see since COVID that a lot of the workers, they are not getting enough of the pay to compensate their long working hours. We also see the projection of the future decreasing labor in healthcare and long-term care. And so this also holds true for both the developed and developing world. So what would be important is how do we make sure this budget will really go into the hands who are really taken care of in the healthcare system? And then how this would also go into the developing world, especially when those are really taken by the informal care of form. And this is what I would like to see the $1 billion will also go to. Thank you.
Thank you, Montira.
Yes, thank you. I think there are, a lot of things have to be done in parallel in efficient and coordinated ways. But one major barrier, I think, to addressing through a systems-based, multi-sectoral approach to addressing climate, health, and equity together is to overcome that limited participation of communities. So new ways of engaging communities to strengthen, and that will take strengthening community skills and leadership to engage them in the co-design and co-implementation of actions, I think is critically necessary because of more and more emphasis on localization and needing to sustain impact of the interventions we're trying to test on the ground. So, which means that we have to shift a little bit the way that we do science and design research questions, because they need to be done and designed with decision makers, users, communities, beneficiaries in mind. So from that outset, their engagement is needed to understand knowledge gaps to be filled so as to inform, again, the design of research projects over the long term. And these stakeholders I mentioned should play a very, very active role in the research process from the beginning through and to the end. Multi-sectoral governance must be inclusive of community engagement. And this is going to be important for building shared understanding of the climate and health problem in context. And as I said, co-designing interventions and their implementation to be sustained.
Okay, thanks, Montira.
Thank you.
Another question. When we're talking about climate change and mitigating its effect on health, I think it's important to think about policy. And if we look at the policy science interface, we need to build the trust at this interface. How do you see we can build this trust between policy and science? So,
Anyone want to start?
anyone wants to comment?
Between policy and science? Yes. Well, we have to engage with each other much earlier. We shouldn't have policymakers as end users of our product, but and I think more and more our projects and in environmental epidemiology in my field, we're talking more and more about policy-driven research. So we have policymakers from the start. We are doing some of that in Copenhagen municipality. We help them design the projects, what they need to know to make some changes in the city, what citizens need to know, what their politicians need to know. So I think that that's the way forward, that we, from early on, from designing research to delivering results to collaborating in the middle, in the entire pathway, work together with policymakers. I think that will open more door to understanding, trust, and more effective policies at the end, I hope.
I think one more issue that's connected maybe indirectly to trust is something that we were discussing with Zorana just before this meeting, is that a lot of policymakers still tend to work in silos. So you discuss with the health ministry, you discuss with the environmental ministry, with the climate ministry, and somewhere along the way you're not sure if your message is actually getting translated, because climate change, air pollution are now transcending these kind of boundaries. So I think that's another important space to work on, because we are all interdisciplinary, working on very issues that transcend these spaces. So I think also policymakers need to understand that just because you're a health policy maker doesn't mean you will only hear about health. I mean, we're talking about transition of fuels, we're talking about air pollution, we're talking about various other things. So I think that trust and that intersection needs to be addressed also in communication.
I think that's a two-way process. I think the issue here about trust is the lack of commitment, especially from the policy makers or the politicians. Usually there are commitments, especially during the gatherings like this one. They make so much commitments, and then you find that it becomes difficult if those commitments are not being fulfilled, especially by researchers. If there are funds that need to be released for researchers to conduct research, then it's going to be difficult for researchers to produce all that empirical evidence that is needed to drive policy. So I think the trust that we need to have, or we need to build, is towards fulfilling those commitments that are being laid out. I think there was a framework or a methodology that was released some time back called the Nairobi Work Program, which was even adopted by the UNFCCC, and also there were a lot of activities from 2015 when policymakers or parties adopted that framework to use going on, but it just died, it's still there. So we need to commit and fund whatever that we commit to, and then help policymakers drive research and produce the evidence that we need so that we are able to drive policy. I think that's my submission.
Hello, everybody. Apologies for the interruption, but it's 6:15 now, and we will have to wrap this meeting. Thank you very much.
Did you want to say goodbye to everybody? Because we're done.
Okay. Just at the end, I would like to thank our speakers and all our panelists. It was really very interesting discussion. We have heard these case studies. And with this, I thank all the audience for being here. And I take the chance to invite you to attend tomorrow another panel discussion about pushing research boundaries to combat climate change effects on health. This will be at Building 25 in B3 zone, the Egyptian Pavilion. Thank you.